There we go. Hi there and welcome. It is so good to have you with me today. And Happy New Year. I hope that you have had a lovely holiday season, Christmas season. And if you don't celebrate Christmas, I hope you've enjoyed all the love and good wishes that everyone has been spreading around. It's such a lovely time when people tend to be a little more compassionate, a little more patient, a little more understanding, and so good, so good. Okay, so I just seeing all kinds of funky little messages here. Just want to double check. Do we have audio? If you can hear me, let me know. Yes, thank you, Nicole. Appreciate that. Wonderful. All right. So, just a little note for those who will be watching this as a replay, to remember to like the video and drop a comment and subscribe to my channel. Just it helps to get these videos out for more people to see, and that is important. So I'd love it if you would take a moment, because we've got some new people with us today, which is very exciting. Take a moment in that chat box and just let me know where you're from. And you don't need to give me your actual street address, but just a state or a province or a country, preferably a little more than Canada or USA, a little more specific than that. It's just fun to get to know who's with us today. And we've got Milton, Ontario. Thank you for that, Bo. Thank you very much. Milton, Ontario. Love that. Anybody else want to let us know where they're from? Again, just breaks the ice a tad. And I'd also like to know if you have any background in iridology. Do you have any iridology training already, or are you pretty new to this? That will help me to know how deep I can go today as well. While you are doing that, what you're going to find is the more you play with me in the chat box, the more comments you make, the more information you'll get from me. If I feel like you're falling asleep, I'll kind of keep it really surface and we'll wrap up early, right? So while you're letting me know, typing in where you're from and what you've got under your belt, that will help me. And we've got Sana or Suna from Iceland, master herbalist and an iridology student. Cool. Very exciting. All righty. And anybody else who wants to weigh in, please do. So when I'm teaching, I am teaching to the practitioner level. Okay, so if you're here for a hobby interest, that's fine, but I am going to be addressing this as a practitioner level thing. Because as practitioners, we are often looking for ways to assess our clients' health so that we can create more effective programs for them. But one of the things that we want to avoid as we're doing our assessment is we want to not spend more time, right? We don't want to spend hours creating an assessment, writing a report, and then getting that information back to our client. Our clients typically want information right when they're with us. They want us to be able to assess them here and now and give them some actionable steps that they can start implementing right now. Do you agree with me on that? That clients want some feedback on the spot? They typically want to leave your office or leave your Zoom meeting with them knowing at least something that they can start working on. Does that sound about right? If it does, give me a yes. I know one of the frustrations here while you're typing in yes, is that one of the frustrations here with the medical world is, number one, it takes you 3 or 4 weeks to even get an appointment. And then if the doctor requisitions lab tests, you have to make an appointment with the lab, and that can be 2 to 3 weeks to get that appointment. And then, another few days for the results to come back. And then you've got to book another appointment with your doctor. And that's going to be another 2 or 3 weeks to get the results. By then you're either dead or you're all better, right? And so we want to avoid doing that. Nicole says she's from Georgia. She's just finished the iridology program. Yes, she has. And she's working on her certifications. Fantastic. And I love that my students work towards certification and achieve it. That is such good stuff. When we are looking at iridology and sclerology, we are able to combine that with whatever other techniques we have, and we can create an assessment and a protocol in that appointment. And we can use that same set of iridology photos over and over again for about a year before we need to be looking at the sclera some more to see what changes have happened there, right? And so when we create our programs based off symptoms lists, maybe you use an extensive intake questionnaire with your clients. I've had some practitioners say their intake questionnaire is 35 pages long. Okay, this is just me. I wouldn't. That to me is a waste of my time and a waste of my practitioner's time. It's going in too many different directions. It's not targeted to what my needs are. It's the same questionnaire that everybody gets. And so when we're using those kinds of broad questionnaires, it often doesn't help us to narrow things down. Often it muddies the water and it adds to our workload. Clients don't like filling out those forms. At least most of mine don't. I've never had anyone say, oh, yippee, give me more pages to fill out, which is why I don't give them any to fill out except a release form. Maybe you run tests like an IgG or an IgE test, and those can have false results. And they might confirm they might actually just confirm that the client has symptoms, but not why the client has symptoms. When we use iridology and sclerology and combine it with symptoms, yes, with diet, with lifestyle, with family history, we can often get to the root of the problem very quickly. And it will help us to start creating personalized programs immediately. We're not waiting weeks for appointments and labs and results to come back. We can start working right now. And so knowing how we can combine sclerology with iridology can actually reduce your assessment and program creation time. I know that things don't usually work that way. Usually when we add modalities, it adds to the list of things we need to do and it adds to the amount of time it's going to take. But when we do sclerology with iridology, it actually speeds things up when you know how to do it the way I teach it. So we're going to look at that today. We're going to learn a little bit of sclerology and we're going to combine it with some iridology and see what kind of a powerful tool this is. Just wanted to share this with you right out of the starting blocks. Angela Hodges, one of my certified graduates, certified with the International Iridology Practitioners Association. This is what Angela posted on their site about the dynamic iridology course. What a fantastic course with a fantastic teacher that actually cares about your success. I'm so happy that I found her. I'm a registered dental hygienist, have been for 20 years, but have been studying naturopathic and homeopathic modalities on the side to help my own family. Now I want to open my own business using iridology to help others be healthier. I've already signed up with Judith for her next class so I can brush up on the body systems and learn herbology along with it. So that's so fantastic. That's what I aim for all of my students, that they learn iridology at a level that allows them to be very proficient to be able to use it in a clinical setting. So both iridology and sclerology are assessment tools. They are not diagnostic tools. So what is the difference between assessing and diagnosing? What do you think the difference is between assessing and diagnosing? I want to see some answers in the chat box. You may not have realized this is an interactive class. What is the difference between assessing and diagnosing? What do you think? I'm suspecting that somebody is typing madly, and we're just going to wait for a second for them to type something in. While we're waiting, and hopefully someone is answering this, When we diagnose, we name a disease. Now, we already know that that's a problem, right? And we know that because even clinics like the Mayo Clinic, when they do autopsies, have about a 20% error rate in the diagnosis. The challenge with that is if you name a disease and treat based on the disease name and you got it wrong, you've given the wrong treatment, correct? And so as iridologists and sclerologists, we don't diagnose. We do not name disease. We assess. Assess means we gather the data, we weigh the data, and without naming a disease, we figure out the pathway of what is going on in the body. How does one thing lead to another, and where do we need to start? What is the root of the problem? So we know the iris shows us genetic potentials. That means where the strengths and weaknesses are and which organs want to negatively impact other organs. The sclera shows us where the body is struggling now. So the iris is genetic, the sclera is dynamic. Now that may sound like the sclera gives us enough information with which to create a program, but the sclera alone doesn't do that. It doesn't help us to see the order in which the problems should be addressed for best results. We need the iris to help us sort that out. So we need these together. That's exactly why we teach both in the dynamic iridology program. We always want to have 2 or more indicators teaching us about any potential problem, because each indicator adds a layer of depth to our understanding. We never base an assessment completely on one iris marker or one sclera marker. We want to see the interaction of the markers, and we want to see the symptoms. Yeah, son of the sclera, the iris is genetic and the sclera is dynamic. So when we are looking at indicators, we pretty much want to see an indicator from the sclera as well as things in the iris. So the iris shows us what the genetic predispositions are. Then the sclera shows us what's out of balance now. And when we put the predispositions with the what's out of balance now, it helps us to understand how things got out of balance. We can start to backtrack and connect. This organ goes back to this organ, goes back to this function, goes back to this function. Aha, here's the root of the problem. So we need to know both sclerology and iridology. And of course, I can't teach you everything about sclerology that I'd love to in a mini class. So today we're going to look at some real life applications, and we're going to look at how this works in a professional setting. Truly, when we dovetail iridology and sclerology together, we get a clear understanding of what the problem is and what we need to do to get to the root of it, to correct the issue. And as we correct the issue, when the client does enough homework, the sclera should clear, as long as the problem has not been so long standing that it is completely ingrained. Iridology and sclerology are both learnable skills. And the truth of any skill is the more you practice and the more feedback you get, the faster you get good at using it. Does that make sense? Does that make sense? I mean, I don't know if any of you were tortured with piano lessons as a child the way I was, and you go for your lesson and they teach you something and you're supposed to go home and you're supposed to practice and practice and practice. And as you practice it, you get better and better. And then you go back to the next lesson and they give you more refinements and they give you coaching about how to improve it. That's exactly how we learn iridology and learn it well, and how we learn sclerology as well. So with the best training, you'll also then begin to understand how to integrate what you already know about nutrition or herbology or aromatherapy or physical therapy or any other therapy with the sclerology and iridology to get the best results for your clients. The idea of learning iridology is not just to learn a standalone thing where you can assess a client. That's of little value to anybody. But when iridology is taught correctly, You learn how to assess the client and how to integrate the modalities that you already have with iridology. Does that make sense? If that sounds like it would make iridology more powerful for you to actually be guided through understanding how to integrate your modalities with it, give me the word power in the chat box. Have you ever had to learn a new something and it was a standalone and you couldn't integrate it, or you had to struggle to integrate it? Was that powerful? Because I'm wondering if many of you are sipping too much tea while we're talking today. So with dynamic iridology, that's what we do. We teach the iridology and the sclerology, and I work with you to teach you how to integrate it with what you already know. And we start with that literally on the second lesson. We start getting you to think about what you know, how does that integrate? And so some of you might, some of what we're going to do today is we're going to look at why it's also important that you have anatomy and physiology under your belt. Because if you don't understand how the body works, how are you going to understand iridology? The iridology and sclerology teach us about the body, right? So those of you who are MDs, NDs, physical therapists, massage therapists, anything where you've had to study anatomy and physiology, you are ahead of the curve. You already know, have some foundational stuff that you're going to rely on here. So when we do an assessment, we look at the iris, the pupil, and the sclera, right? So the iris is the colored part. The pupil is the black hole. It literally is a black hole. It's a hole in the eye. And we look at the sclera. Each of these things give us different information. And we learn about each of these in the dynamic iridology assessment system. We learn about what the shape of the pupil teaches us. We learn about what the edge of the iris as it bumps up against the pupil, what that teaches us. We learn about the iris itself, and we learn about the sclera. So the pupils give us some unique information, some of which is inherent and some of which is dynamic, and we don't have time to go into that today. The iris certainly gives us a lot of information, but the sclera, that's where we're going to focus. This is where we can see changes most easily. And you know this. If you've ever had a really hard cry and your eyes went bloodshot almost instantly, you went into the washroom to splash some cool water on your face and pat your face dry and let the swelling around your eyes go down, you know how quickly that bloodshot, how quickly that swelling came up, and you also know how quickly it will go down. So that bloodshot, the bloodshot appearance of the sclera, that shows you how rapidly the sclera and the circulation in the sclera can respond. So when we are looking at the sclera is telling us the story of what the body is doing now. Now, in the dynamic iridology system, we teach 12 of the most important, most common sclera markers, what they teach us about health challenges, and how to assess them in conjunction with iris markers. Today, we're going to look at 3 of those markers. So the first one, this is a male client. He was in his mid-60s when we met. One of the things you will notice and see quite easily is the amount of yellow in his sclera. Medically, this would be called jaundice, right? Now, I can't call it that technically. Well, yes, I can. I'm just describing a color here. Jaundice is just the name of the color. It's the French word. It just means the eyeballs are yellow. Right. So depending on your device screen, you might have problems seeing this. Not all screens are created equal. Now, what we know about this medically is jaundice suggests that the bilirubin is not being conjugated properly. And that is an indication of a liver enzyme imbalance. That can be a part of bigger problems, right? So if you see jaundice, you need to ask questions to find out what the client knows about their liver health. Now, most people haven't got a clue what the liver does. So you need to know how to ask questions to get to the root of this. And that's something that we work on in dynamic iridology as well. So has this person ever been diagnosed with something that would cause this symptom? Is it a benign situation that could be supported with nutrition or herbs or lifestyle, or is it potentially more serious. There are different conditions out there, genetic conditions where people tend to be jaundiced most of the time, and it's benign, generally speaking. Some increased risks of things, in advanced years, but early on it's quite benign. But there are things we can do to mitigate this at any rate. So this is just one example of why you need a college level A&P. You need to understand, what is bilirubin? Where does it come from? How does it, you don't need to know the whole mechanical and chemical pathway of how it gets broken down, but you need to know that the liver breaks it down. You need to know what makes it build up in the body. What are some of the lifestyle things that make bilirubin accumulate and not get broken down? And so that's where your anatomy and physiology will come into play. And if you understand herbology, and if you understand what jaundice is, and if you understand a bit about nutrition, you'll understand how to work with this and how to begin to control this a bit more. Now, in the iris, you will see that he's got a transversal right here. That suggests a genetic predisposition towards liver imbalance. So we've got sclera is jaundiced, iris transversal that suggests the liver wants to be out of balance. So now what we need to do is we need to know what is his diet and what is his lifestyle. So here's this fellow's story. He is an older fellow, like I said, in his mid to late 60s. He doesn't drink alcohol. He does take supplements. He is not on any medications. He has worked a lot in chemically toxic environments in the oil patch. While that won't necessarily change his iris, it will change something, or can change things, in his sclera. So in his case, again, we've got the genetic predisposition that says there is a risk. We've got the sclera saying risk is being fulfilled. And this is telling us that this risk is coming to fruition. So if his concern was that he had noticed his eyeballs becoming yellow, we can certainly give some very broad recommendations here. Things like sunshine. In the hospital, if someone is extremely jaundiced, especially if you're thinking of newborn babies, they go under the UV lights, right? They go under the billy lights, as they're called. So sunshine can help the liver to conjugate bilirubin more effectively. We also need to make sure that he is eating on a regular schedule. When people that have elevated bilirubin fast or go long periods without eating, the bilirubin will elevate. Right? So we need to make sure that we're getting some sunshine and that we're getting him to eat good, wholesome foods on a regular schedule. We would also suggest that he go to his doctor and get some labs done. Right? We can start working with this now, but it would be really nice to have some baseline numbers that can be tracked over time, so that as we see the eyeballs becoming clearer, becoming whiter and cleaner looking, we should then see his labs also correcting. And so even without the labs, we can still work. It's just nice for baseline. And so we need to be supporting his liver. And that means, again, that we need to get him enough water on a daily basis. We need to get him good, healthy foods, including leafy greens. We need to get him adequate sleep. Skipping sleep is another thing that allows bilirubin to accumulate. And we need to get him some sunshine. Some pretty easy starting points that we can start working with right now. We can monitor his eyeballs to see his sclera, to see if that jaundice is settling down. Notice also that we've got gray clouding here. That's another sclera sign that we might want to chat with him about over time. There are a lot of different causes for this, but there's a very common one that has to do with circulatory compromise, right? And so he's at that age, being in his late 60s, where circulation could be becoming an issue for him, or may have been for some time, and he might just be ignoring it. Kind of the man thing to do, right? The next one we want to look at is this one, and we call this a meander. Meander, just like a meandering river, right? A stream through a farmer's field. So the story here is, this is a man, he was 70 years old when we met. He's got a couple of different jobs, if you will. He works in the oil patch downtown Calgary, so he's not out in the field. He does consulting for oil companies, but he also has a hobby farm. And on that hobby farm, he does not have a lot of equipment. So he is throwing hay bales around to feed his horses and his cows. And he's, mucking out the stalls by hand. And he's doing everything manually, which is fantastic because he is lean and he is fit. And so he has no hired help. He does this all on his own, which is just the best physical activity ever, right? So what would he like my help with when he came in? He came in because I met him through a Kiwanis club, and I had he was therefore on my mailing list. He had agreed to be on my mailing list, and I sent out an invitation saying, hey, I've got a new camera. I'd love to have you come in. I want to take pictures, and I want permission then to use your photos when I teach. And in exchange for that, I'll give you a couple of tips. I'll give you some information about what I see in your eyes and a few tips. And so he wanted to come in. He was just curious. He wasn't really going to be a client. He was just curious, and that's okay. At the age of 70, he had no known health issues. And again, he was on no medications, which is quite remarkable. Quite remarkable. I don't know very many 70-year-olds who are not on at least 1 or 2 or 6 medications. So I checked out his pupil size and shape, and you'll notice the pupil's not quite round. And that gave me an understanding of things, but I also noticed that we have these meanders in here. And these meanders are quite bold. They are quite prominent. And that prominence tells me they've been here for a while. Now, this suggests that we've got circulatory congestion building. Didn't have symptoms at the time we did these photos. That was about 5 years ago. I'm betting that we would maybe have a different conversation now. So he and I had a conversation about his health history, his diet, his lifestyle. And again, this was a 30-minute session. This wasn't my normal hour and a quarter first session, right? So we found out that his diet's okay. It's not great. He does eat vegetables, but he also drinks coffee, quite a bit of coffee. He raises his own beef, so he eats a lot of beef, and I have no problems with people eating beef. It's just if it's not balanced with enough plant matter, that can be a challenge for some health concerns. Lifestyle is very active. He does drink a fair amount. He has a lot of buddies, and whenever they get together, they drink. And they own a vacation property in the mountains, and they all get together on weekends to go there and drink. So he drinks a lot. Now, knowing all that, then we need to think about, what does that mean? What does that mean? Well, when we combine this with this, which is telling us his liver enzymes are likely out of balance and that he may be building either triglycerides or cholesterol, and we see this predisposition towards circulatory congestion, we have a pretty clear picture that he's been doing things that have not been supportive for his circulatory system. So with him then, we needed to, I suggested that he maybe should go to his doctor and get some labs done, right? Especially for the triglycerides and cholesterol, right? Really important that he get that done and know where it's at. And blood sugars, I suggested that he should get a hemoglobin A1C, because the liver not managing carbs properly can throw them towards blood sugar issues as well. And his sclera again shows us that he's moving towards cardiovascular congestion, possibly elevated lipids, elevated cholesterol. And then if he were to come back, I would still give him homework to do, right? I would be suggesting that he reduce the coffee. That's our starting point, ultimately get rid of. Reduce the alcohol. That's going to be hard because I know a lot of the guys in his social club, and they get together specifically to drink. So to reduce alcohol consumption is going to be very difficult, but very important here. And increase the leafy greens. right? Because leafy greens are going to support liver and help us in many, many ways here. And so that's what I would do with that. If he were to become a long-term client, I would probably I would take it deeper. But on a first appointment, I always keep the suggestions at a level that are achievable. So important to not overwhelm a client on the first appointment, because then they never come back. And that means they don't get results, and because they're not doing the homework, right? So you start with things that are achievable. They may not give dramatic results right out of the starting blocks, but the client is showing you they are capable of making changes and therefore capable of progress. And that's exactly what we want to see. Now, this alone gives us some information. This alone gives us, and more meanders down here, give us more information and more meanders up here. And so we need to combine all of this. Is this making sense? That the sclera and the iris work together? If that is making sense, give me a makes sense in the comments box. Fantastic, both. Thanks for that. Really appreciate that. This was a female client in her mid-30s, came to me wanting help with allergies and depression. Both of those problems, both of those symptoms have many physiological root causes. So we started with looking and noting that she has a pinguecula in each of her eyes, right? You can even see it on the frontal shot here, pinguecula, pinguecula. That tells us that there are issues processing proteins and fats and calcium. When that pinguecula is yellow, these can be kind of a little rainbow of colors, but when they're yellow, it usually suggests the biggest problem is with fat metabolism. Now, this is a woman who is a personal trainer. She's very physically active, and so she's very fit. What we need to know here is the pinguecula has built over time, but once it is built, it's not going to go away. They can be surgically removed, but they do have a high risk of growing back. It's interesting that these irides also show us with other markings that we've got a strong predisposition towards liver imbalance. Now, traditional Chinese medicine says that depression comes from the liver. So we've got iris markers and sclera markers pointing to the liver. So we're going to do some liver work here. And it's not just liver work that's for the next 4 weeks. It's liver lifestyle, right? In order to bring this liver back into balance, we have to have a lifestyle, not just a treatment protocol, right? So we would pick and choose appropriate herbs, perhaps, definitely some dietary work, and definitely some lifestyle work. And, when we recognize that depression comes from the liver, we might even want to do some emotional work with her if we've got that training, or if we have someone that we can refer her out to work on the emotional stuff. Now, part of her story is her mother is elderly and was in a care facility and started to develop dementia, and it was progressing very rapidly, and the care facility was no longer able to take the mother. And so this woman took her mother in, and her mother lived with her for about 18 months until this client of mine totally burned out. And this is about the stage where we're seeing things just before we hit the burnout stage. And at this point, the client started talking about where was a facility that would take her mother with rapidly advancing dementia, right? So with this client, we started with a dietary change. One of my favorite easy ones, because she wasn't drinking coffee, was to get her to have more leafy greens. Suggested using a herbal formulation from Nature Sunshine Products, which is my favorite herbal company. And she's already physically active. And so I actually had to encourage her to get some rest, to prioritize rest. I also added some aromatherapy and a flower essence formula to help her with some of the emotional things she was going through. So when we do iridology and sclerology both together, they help us to understand more about what the imbalance is and how to work with it, how to follow it back to its root. It takes training and practice and feedback and mentoring to get to where you can do this at a clinical level. This is certainly not the kind of thing you learn from a YouTube video or from a textbook. None of those things can teach you the nuances. And that's exactly why I teach dynamic iridology the way I do. The encapsulation, this is the last one we're going to look at today. See how this blood vessel comes and it makes a hook, like a shepherd's hook or a candy cane. This one, where it loops around completely and closes off, these are different clients. They aren't the same person. These are what we call an encapsulation, and they suggest that there is some kind of toxicity or an infection that is localized and the body is sequestering it. When we have this, it says not quite all the way closed off. When we have this, the thing has been totally sequestered and a wall is being built around it. So these pockets can be so small in the body that the client may not be aware of the problem, or they can be as obvious and large as a swollen gland or a cyst or an abscess. So when we understand what this marking is and where it's placed, where it's sitting, is going to tell us where the encapsulation is happening in the body. When we understand that, we then can understand what we want to do with it. Now, honestly, an encapsulation that is closed off is probably not as important to deal with because it doesn't have access to the blood supply or the lymphatic supply, as long as it's not in a lymphatic node, right? A partial encapsulation like this, we still have the free flow of stuff to go in and out. We can send nutrients in to clean this out. We can pull garbage out and do it slowly and methodically to help get rid of this encapsulation. So again, understanding where it is will help us to understand how to work with it. Understanding whether it's complete or partial will help us to know whether we should look at it right now or whether we can maybe just ignore it for a while, right? And knowing whether it's complete or partial will also help us to understand what kinds of symptoms we might be facing. Does that all make sense? Do you see how this adds a layer of depth of information? If you do, give me layer in the chat box. So I just want to take a minute to introduce myself before we look at another set of eyes. Now that you've been listening to me for about 40 minutes, my name is Judith Cobb. I'm a master herbalist, natural nutrition clinical practitioner, and a certified level 3 iridology instructor with IPA. And with this, and actually that's what this was all about, that I skipped right past, IPA has very stringent standards, both for their iridologists and their instructors. We have to upgrade. We have to do upgrade every 2 years, which is why these badges say they expire in 2024 and why they started in 2022. I've actually been an iridologist for 4 decades and an IPA certified iridologist since 1993 was when I first certified with them, and of course have updated and so on since then. I am one of only 8 level 3 instructors in the world. That's a level that was added in 2022. And so, 2021 rather. And so there are only 8 of us in the world that are qualified to teach the level 3. I love iridology. I love the standards that IPA has set. And that is why I teach to their standards to prepare my students to certify with them. I'm a professional member of 2 nutrition organizations and the Alberta Herbalist Association as well. And when I teach iridology, we do integrate a little bit of the iridology, a little herbology, a little nutrition as well. And so if you've got background in that, we can really draw that out. Here is another client of mine. This is Nick. He was 79 years old when we took these photos. He came in saying he wanted to lose some weight. He had some excess abdominal weight and enough that it was starting to bother his knees, which was making it difficult for him to walk. He had recently gone through prostate cancer that was treated with radiation and hormones. And of course, the hormone they use is a form of estrogen, which puts weight on whether you're a man or a woman. His medical diagnosis from his doctor was congestive heart failure. He also had irregular heartbeat, shortness of breath, reflux, and heartburn. He was on 8 different medications, including an anti-anxiety medication to help him stay relaxed when he was having problems breathing. Anyone see any problems with all of this? He also had a hiatal hernia that was not diagnosed by the doctor, but I did there's an assessment that I can do that suggests what we would describe as a locked diaphragm, which is a non-medical term for hiatal hernia. So I referred him to an osteopath and that to be assessed and to work on that one. I'm also insulin resistant and excessive uric acid based on his lab tests, and he was not being given any meds for those, which is maybe a good thing. He has the gray patches in his sclera, which again suggest circulatory compromise, that the circulatory system is collapsing, basically. He's got a pinguecula, which again, liver, carbohydrates. Oh, could that tie into the blood sugar issue? And we have fermentation signs in his sclera as well, which again suggest either a risk of candida or that he's not managing his carbs properly and is moving towards type 2 diabetes. When we look at his iris, we see actually in the cornea, we've got the lipemic diathesis, which again suggests liver. We've got the orange pigment, which, and on my computer screen, this is orange. It may look rusty brown on your computer, but if it's an orange pigment is all about pancreas and liver. We've got dirty yellow throughout, which tells us that his body doesn't manage uric acid very well. And we now know from research, from clinical trial research, that elevated uric acid is a key player in insulin resistance and in cardiovascular issues. Okay, so we brought in his labs. His hemoglobin A1C was 7.7. That's insulin resistance, type 2 diabetes right there. And we want that to be under 5.7. He had low leukocytes. His lymphocytes were very low. His hematocrit was low. His erythrocytes were low. His testosterone was very low, and he had elevated triglycerides. So initially, he went to see the osteopath to get some exercises for his hiatal hernia. We started him on berberine IR to help bring his insulin around, right, to make him less insulin resistant. And we used a glucosamine blend for his joints and for his gut health. Glucosamine is very, very good for the gut. And we did omega-3. We worked on his diet. His breakfast was rice cakes. Does that sound like a good idea for someone who is insulin resistant? And his snacks were rice cakes. He was being told they're low carb, therefore they'll help you to lose weight. No one told him, sorry, not low carb, low cal, they'll help you to lose weight. No one told him they're high carb, they'll put fat on you. Okay, so we had to work with that. So we replaced his rice cakes with protein. We got him to add more veggies at breakfast time. So we got him doing eggs, whole eggs, and vegetables as a stir fry. And we started pushing him to walk 30 minutes a day. And it was, if you can't do 30 at a time because it's too hard on your knees, do 5 minutes 6 times a day. And that's where he started, was 5 minutes at a time. He sent me an email after a couple of weeks saying if anyone had ever told me that I would be enjoying vegetables for breakfast, I would have told them they were nuts. But he was. Suggested that until we got that hiatal hernia dealt with, that he needed to sleep on a wedge pillow. And what he reported after 4 weeks was, number one, he could walk for 10 minutes at a time with no pain. He was losing inches around his belly. He was so excited to be wearing pants that he hadn't worn in 3 or 4 years. And he found that sleeping on a wedge, he was able to actually sleep better because he could breathe more easily, right? And he wasn't having the reflux at night because he was on a wedge. Simple things that nobody had ever suggested. Over time, he came in at the 8-week mark and was ecstatic. And I was like, tell me why you're so bubbly and happy. And he said, I have never lost a pound a week for 8 weeks consistently before. I am now down 8 pounds and 3 inches on my belt. It's like, holy doodle. I wouldn't have known to go after all of that quite that way if I didn't have his sclera, his iris, his cornea, all of it, right? And we were able to do his appointments and keep them on time and not overwhelm him. So, so important. So what are you seeing here? What are you seeing that's making you go, this is interesting? I'd like to see some interaction in the chat box. What have you seen or heard here where you've gone, wow, that's interesting. I didn't know that before. Do go ahead and get those answers in because I'm really interested to know if this has been of value to you. The fermentation, I would like to know more about that. Wonderful, Sana. That is something, again, that we dive into quite deeply in the course itself. So in the dynamic iridology assessment system, the entire purpose, and if anyone else has something to share about what they found interesting, that would be great. But the purpose of the dynamic iridology assessment system is to help you learn iridology, to do faster assessments, be even more accurate, to help you build better and faster rapport, and to eliminate the need for those lengthy questionnaires. This isn't necessarily so you can rush through your client work. It's to give you more time to build the rapport in your client sessions, but to make it so that you're not working outside of your client sessions to create protocols and do assessments. It's to help you actually get all of your work done while you are actually with your client in session. How many of you now are seeing clients? I would just be curious about that. How many of you are actively seeing clients right now? None of you? Huh. Okay. That's interesting. Then I guess this might not have been the most valuable time for you because if you're not seeing clients, that's where we're headed. Karen Choate said this. She's a certified grad from my program. I just returned from a regenerative detoxification course where iridology is implemented. Most people I talked with did not have anywhere near the same experience with their iridology education. No support, unanswered questions, and a lot of confusion. Mostly they finished their classes not knowing how to implement what they had learned. I feel so absolutely blessed to have been taught by you. I feel totally supported even still as I've graduated almost 5 years ago now. I don't think there's anyone out there practicing, educating, and teaching iridology like you. Very, very cool. And again, Kimberly Zadalis posted this on the IIPA site. Kimberly's one of my certified grads. And Kimberly has so much training under her belt. She has a master's degree in radiology, and she works as a radiology consultant. And she has a clinic where she practices Eastern and Western medicine with her own patient load. She says, if you're wondering which iridology course to take, you can stop looking. You've found it. Judith Cobb is an excellent instructor with many years of experience. She is caring and compassionate, dedicated to the field of iridology and her students. I personally practice both Eastern and Western physiology medicine and was very impressed with the layout of her program. She makes it easy for her students to balance work, life, and study. Love that. So the dynamic iridology assessment system is a course that is for health professionals. And by that, I mean people who have completed a college level anatomy and physiology course, right? If you don't have the A&P, I will not take you, but I will give you guidance as to where you can get your A&P so you can come to me to learn iridology. As you've seen, when we're looking at the eyes, we're not looking at one marking means one thing. We're looking at how things interact. And we need to then understand how the body works in order to understand those interactions really well. The dynamic iridology system is the only live, online, fully mentored course for nutritionists, herbalists, and naturopaths and other health professionals who want to streamline their clinical work without sacrificing client care, so they can stop working unpaid overtime to develop their client programs, stop overwhelming their clients with undoable programs, and create programs that will increase client compliance, success, and long-term retention. Too many practitioners see the client, gather data, go off and spend 2 or 3 or 4 hours creating an assessment and a protocol to bring that back to the client at a later time, or worse yet, to email it to their client. If it takes you 4 hours to create it, you've overloaded your client, you've overwhelmed your client. The idea of learning iridology and learning it this way is to understand what to focus on so that you can create a program that your client can do for the next 4 weeks and be successful with. They can lay that foundation, then you see them again in 4 weeks. You build on that foundation, see them again 4 weeks later, build on that foundation. So you're building their program, you're building their wellness lifestyle step by step so that they can have a lifetime of success. This is how I have built my practice. I have now got clients with me when we talk about long-term retention that have been with me for 4 decades. We chuckle when we get together because we try to remember, because I've got 7 children and most of my clients back then were also working on having a family. And we chuckle and we talk about what baby did I have in my arms? What baby did they have in their arms when we first met? So if you've got a college level A&P course with a grade of over 80%, and you are curious about this course, you're thinking that learning iridology might be the thing for you. If you want to learn iridology and sclerology at a professional level, if you want to learn how the markers play off each other and how to do this in a clinical setting, if you want to learn what questions the eyes want you to ask, right? That's a really important thing when you are combining things. What questions do the eyes want you to ask? If you want to learn how to create programs your clients can be more successful implementing, if you want to be mentored for the long term, and I am talking years, not just when you're enrolled in the program. Oops, I didn't correct that link. Let me give you the right link here. Then we should have a conversation. Just let me, actually, if you just take the inside off the end, my fingers are dyslexic today, tinyurl.com/dynamic-iridology. That will work. You can do the inside if you want. It's just a lot to type. But let's set up a Zoom meeting. This is to set up a Zoom meeting for us to talk about you, about your goals, about what you're doing, about what you want to do, where you want to go, for us to decide together, is this course going to be a good fit for you or not? That's a really important thing, that I don't accept everybody into the program because some people aren't ready. And for some people, it's just not a good fit. My focus here is teaching professionals. Nicole, who is with us today, is one of my graduates. She's a herbalist. I think she manages a health food store because she often comes to class from her store, I believe. And yeah, fantastic. She works with clients. I'm interested in working with people who want to do iridology professionally, but you need the anatomy and physiology before you come to me. I'll teach you the rest of the iridology stuff. So the course is taught by a 20 2.25 hour long live interactive webinars. We meet once each week for 20 weeks. We have, the classes are all recorded. Your classes are recorded and placed where you can view them. So if you have to miss a class, no big deal. It's there for you. If you want to review, it's there for you. Every month we have 2 live online 1-hour mentoring sessions. These are group mentoring sessions where students can bring cases they're working on. They can ask business questions. They can ask just all kinds of stuff. Today in our mentoring session, we had a Facebook ad specialist come and help introduce us to Facebook ads, which was very cool. Very cool. Mentoring continues even after you complete the course. So you can continue to come to these interactive mentoring sessions as long as you promise to be a nice person. That's the only qualifier. I've got many of my students who keep coming 5 and 6 years after the fact. The 225-page downloadable textbook is included in your tuition. The 45 pages of cheat sheets, which are downloadable, are included in your tuition. Those are my gifts to you. And unlike some iridology instructors, I limit my classes to only 10 students because I want you as a professional to have the time to ask the questions and to get the depth of answers you want. I know that if I took 20 or 30 or 40 students, you would get lost. Your questions wouldn't get answered. You would get frustrated, and so would I. My goal is, again, to make sure you are taught well, not just to grab your tuition and run. And I mentor for the certification exams as well. IPA has an exam, a certification protocol, and I include the mentoring in your tuition should you be interested in certifying. So again, if this sounds like it's of interest to you, let me know. You know, most teachers charge extra to mentor you for the exams. Most teachers make you buy a separate textbook, and the textbooks run about $250, right? Nobody that I know of does the extra mentoring, and nobody mentors you after the fact. Okay, this is important. I know that I still have questions. I still go back to my teacher. I certified under him 30 years ago, and occasionally I get a question. I call it my 2 a.m. questions. I just go back to him, ask him, and I know that when he has time in his busy naturopathic practice, that he will get back to me on it. It's so important, so important. The next class is starting on January 25th. So if you are thinking, this sounds interesting, I would like more information, and you've got that A&P, and January 25th sounds like a good start date for you, use that link and let's have a conversation. So just talk with me. We'll book a Zoom meeting. We'll have a conversation. Not a threatening situation, and not a situation we're going to try to strong arm you into anything. This is really for us to see if this is a good fit. And if it is, I'll invite you to enroll. If it's not, I won't invite you to enroll. It's pretty simple. Oh, I should have checked this. This is wrong. The next one is starting January 25th, 2024. I thought I had double checked these, and apparently I didn't. Right. And so there you go. All righty. Well, thank you so much for being with me. Are there any questions before we wrap up, or any comments before we wrap up for the day? Again, these mini classes are meant to be a 30,000-foot overview. We don't have time to go into great detail about any of it. It's really to get your feet wet, to help you see the possibilities of what iridology can do for you, what it can do for you in your practice, how it can help you and your clients at the same time. And very interesting, Sana says, I will be sending you an email for further information. Sana, I would just encourage you, let's book a call. Seriously, let's book a Zoom meeting. Just so much easier for us to answer all the questions and make sure that you've got the information you need. I'll probably give you more information than you need, but that's good because I like my students to be informed. Fantastic. I look forward to speaking with you, Sana. That will be really great to speak with you, and good to have you all here. Happy New Year, and we'll see you soon. Bye for now.